Hello, good evening and welcome. Today we will focus on the health conditions of the approximately 18,000 pregnant mothers in Fiji. In August 2021, The Guardian reported that 3 pregnant mothers who were diagnosed with COVID-19 got whisked away to an isolated room in a local hospital with little interaction to the medical staff. One of the ladies, named Jane, had to assist the only midwife in that room, while the other 2 ladies went into labor at the same time. The experts worldwide had suggested that more attention should be paid to the special needs of pregnant mothers during this pandemic. As to prevent the complications caused by the coronavirus during gestation, the Fiji government had been working on a community campaign of COVID-19 vaccine to pregnant mothers. Meanwhile, a team of students from Hong Kong U is proposing a project aiming at providing better physical and psychological support to pregnant mothers. Now let's see what they can do. Our team is proposing a community-based program named Standing with Pregnant Women in Fiji. We're going to focus on the public health workforce development, in anti-epidemic package delivery, community health workers training, and a designated taxi fleet to the pregnant women.
Fiji is an attractive tourist destination with stunning ocean scenery. However, the sudden outbreak of COVID-19 constrained Fiji's tourism due to the long incubation period and rapid transmission rate of SARS-CoV-2. Thus, the economy is being affected. In an effort to recover and control the spread of the epidemic as quickly as possible, Fiji is supposed to strengthen the health system and enhance the response to the COVID-19. A more capable, responsive, and complex surveillance system is urgently needed. With the progress of the fight, the vulnerable group demands more of our attention. The Guardian's news last August made us realize that pregnant women as a special group are also threatened by the epidemic. It is studied that pregnant women, once infected, will have a higher risk for severe illness from COVID-19, besides also suffer a higher risk of preterm birth and pregnancy loss. The epidemic has put these mothers to be in a more precarious position and asked them to be stronger. Therefore, we would like to refine the public healthcare system, focusing on pregnant women in the third trimester.
In the caring package, there is also a self-designed education leaflet for mothers-to-be. The content of leaflets are highly related with the current COVID-19 epidemic and is divided into 3 parts: pre-COVID prevention protection, important information if tested positive, and notes for women who already recovered from COVID-19. For each COVID status, we list a few medical and living recommendations that are essential and easily ignored. The purpose of this leaflet is to provide a few evidence-based COVID-19 health suggestions for pregnant women to better prevent and protect themselves under the epidemic, especially the misleading information during pregnancy such as vaccination, concerns for breastfeeding, etc. Furthermore, with knowing, understanding, and knowledge, pregnant women will be more relaxed both physically and mentally, which creates a light mood for delivery.
We plan to send out a caring package for all mothers-to-be who are in their 3rd trimester of pregnancy in the next 3 months. Through delivering this package, we want the pregnant mothers and their family members to feel connected and being supported by the local community. Meanwhile, literature also indicated that passing the anti-epidemic facts to the public could increase their attention and awareness of COVID-19 prevention. Therefore, we prepared the caring package with the following items. On the right-hand side, there are some products for maintaining personal hygiene, such as hand sanitizer, alcohol swabs, a box of face masks, and 2 boxes of self-testing kits. On this side, we prepared some items related to antenatal care. Here goes the oatmeal, milk, an elastic band, and also a leaflet as introduced.
In 2014, there was a health worker manual for the Ministry of Health in Fiji to promote safe motherhood in the local community. Our program would like to make some amendments based on the special conditions of COVID-19 epidemic. To provide efficient training for the health workers countrywide, we plan to hire 5 experienced trainers from the local universities and the Ministry of Health. After understanding the program objectives, design, and details, they will deliver a 3-day training for 250 community health workers via Zoom. The training will last for 8 hours for each day, and here is a brief timeline for the training schedule.
So on day 1, we plan to have a general briefing in the AM session to introduce the purpose of our program, which is to modify the existing community health worker program with content-specific information about assisting the 3rd trimester women, since they are the vulnerable group under the COVID-19 pandemic. Hence, we would like to eliminate the physical and psychological burden with the help of community health workers in Fiji. And the role of our community health workers will be mainly information providers. For example, they can promote the importance of antenatal health and the prevention of pandemic, as well as to act on the infected case of the third trimester woman. In the PM session, we hope to describe the detailed information of the package and leaflet, like why we're providing the package and leaflet and what is in the package and leaflet, so that our community health workers can also briefly introduce our target service group about the importance of information on the leaflet, as well as the usage of APRUs provided in the package when they manage to deliver.
So on day 2, we would like to stimulate a scenario that might occur with our community health workers. For example, delivery of the package and briefing about the information on the leaflet. Small talk with our target service group as well as answering the queries from their carers. We could also build interactive support groups for them within the community, or even organize some workshops so that they could have the chance to communicate with each other and might thus feel less isolated or bored. And in the PM session, we would like to introduce the protocol management for our community health workers to respond to the pandemic-related issues effectively. We could use the protocol to record the status of getting vaccines for our target service group, information for quarantine and track callback service for the positive cases, as well as the special needs from those who are in low socio-economic situations. The protocol could be also used by our target service group to update their health conditions during the pregnant period.
We also plan to set up a hotline for pregnant mothers in case they need extra information or any kind of immediate assistance. So on the third day, we're going to equip the community health workers with some hotline responding skills. In the morning session, we would focus on their roles as information providers. The invited representative from the Ministry of Health would introduce the local policies and resources regarding the medical assistance for pregnant mothers who tested positive for COVID-19, such as the location and availability of isolation wards in both public and private sectors, and their regarding contact information. At the same time, we also encourage the community health workers to tie up the connection with the medical service providers in their regions. In the afternoon session, we would focus on the psychological support that could be provided via hotline.
A psychologist would be invited to talk about the breakdowns, stress, and burnout syndromes experienced by the pregnant mothers during this pandemic. Meanwhile, we would also collocate and provide the contact information of the therapist in each area, so the community health workers could refer the pregnant mothers to the professionals if needed.
Research studies in the past 2 years indicated that human infection risk could be extremely high while taking public transportations. Factors such as enclosed environment, inadequate social distance between people might result in rapid spread of infection. Therefore, we're going to set up a designated taxi fleet to provide ladies who are in their third trimester of pregnancy with free transportation service between clinics for checkups and their residencies. Based on our limit budget, the designated fleet will provide service 24/7 with about 5 taxis participating in the next 3 months. We would invite the professionals from CDC to set up the anti-epidemic guidelines for the fleet, such as requiring the drivers to perform daily rapid antigen tests before providing service and fully disinfecting the car compartments every 6 hours. We hope this designated fleet could help the mothers to reduce the chances of getting infected.
The budget list includes 3 parts: health promotion, manpower, and pregnancy taxi, which conclude the basic content of program progress. Health promotion consists of leaflet printing, carrying packages, basically medical and living resources for pregnant women, and overall delivery fees. Total cost will be $140,000. Manpower includes salary for 5 professional healthcare workers, allowance for relevant community center workers, certificate for program volunteers, and SIM card for data support. Total cost will be $13,500. Lastly, for the pregnancy taxi, our program will rent 5 taxis for 3 months, and each will cost $3,000 per month. The cost has already covered renting fee plus gasoline plus cleaning and sanitizing plus road costs, and the total cost for such service will be $45,000.
Above are the details of our project. We expect our training program to provide public health workers in the community with more detailed information about pregnant women and help to form solutions in emergency situations, such as pregnant women awaiting delivery or pregnant women testing positive. Our hotline community network, support packages, leaflets, and special taxis are also intended to provide pregnant women with effective information and practical support. so that they can feel not alone in this particular situation and thus develop psychological backing for them, development of public health workforce in some way, and will be with mothers to be in times of epidemic.